Hey, Erik Weiseth, the Executive Director of the Idaho Outfitter and Guides Association. And we have Jack Hurty here, who is our Salmon and Steelhead Coordinator, as well as just kind of general policy wonk that we're bringing in to help us work on this project. So one of the things that we've done recently with all the talk about healthcare issues and the price of healthcare going up, it really made us wonder, how do outfitters and guides in Idaho get health insurance? We really had no idea. I think we had some assumptions or at least some beliefs of how that probably looked, but we wanted to make sure we actually had data to support or to inform really where we were on this. So we sent out a survey to IOGA's membership. So we're talking the outfitters, so business owners and operators within the state, and guides who operate in the state. So now to our membership, had a very significant investment from the outfitters and guides in replying to it. They went through and we had a lot of returns, I think better response than we thought we'd get, and came up with some really interesting information to help inform our understanding of how healthcare impacts outfitters and guides here in Idaho. So Jack, you want to hop into kind of our survey results and walk folks through what we got to see?
Yeah, so we got about 80 plus responses on this survey, which is really, really good for an organization of our size. And we promoted it all across social media, through our mailing list. Hopefully you saw one of our posts about it and took the survey. So if you look here, one of the biggest questions we wanted to answer was, where are people getting their health insurance from? There's a bunch of different ways you can get your health insurance in Idaho. Our industry is very diverse. It encompasses people from all across the state, a lot of socioeconomic backgrounds. And so understanding where those people were coming from was the first step to kind of understanding how we could advocate for them. And I think one of the biggest questions we wanted to know was, how many people are getting their healthcare through the ACA exchanges or the marketplace? If you're in Idaho, that's yourhealthidaho.gov. If you're not in Idaho, a lot of people get it through the healthcare.gov website. And we were expecting to see a lot of people getting their healthcare that way, and the results kind of bore that out. We got about 41% are getting their healthcare through the ACA exchanges. You have some small minorities that are getting it through their employer, through their spouse. A bunch of the younger guides get it through their parents. So if you're under 26, you can get your health insurance through your parents. We had a number of folks that are getting it through the government, whether Medicaid, Medicare, and then a few more in the other category that were getting it through the VA. One thing I really want to point out here, though, is our uninsurance rate. People that don't have health insurance of any kind is about 20%. That's over twice the uninsurance rate for the state of Idaho, which is 8.9% in 2024. So that's something that's really important for us to keep an eye on, because those people they're not getting health insurance. They're probably not getting the healthcare that they need. And if they are, it potentially could be very expensive.
Yeah, I think that was one of the things that really jumped out at me. I figured we'd have some uninsured rate in our demographic, but that number is high. Even most guides are kind of probably on the younger end, and they're healthy and everything else, and it's an expense, and so they just avoid it. But I still was surprised to see that number that high.
Yeah, I was too. But I will say there's been some other studies recently that have shown guides having somewhat high uninsurance rates, although I don't think they saw it quite as high as 20%. So let's talk a little bit about the barriers to healthcare that people are seeing. And I don't think this is going to come as any surprise, but the number one barrier for folks was the cost. And that was true for everyone across the board, whether they have insurance, whether they're getting their insurance through the exchanges, or whether they don't have insurance at all. And costs over and over again was one of the biggest themes we saw. Another thing that I want to point out too is a lot of people felt like their coverage wasn't adequate. And I think that is also true across the board for folks that do have insurance. And they kind of have insurance and they are glad that they have it, but might be difficult for them to utilize it as much as they would like to. One other thing I want to point out too is a lack of trust in the healthcare system. And almost a quarter of our respondents said that they didn't trust the healthcare system, and that was a big barrier for them in getting healthcare. So that's something to keep in the back of our minds on how we might remedy that moving forward.
Yeah, I think there was some other things in here that weren't terribly surprising to me. It's expensive because it is, and my coverage is inadequate. The number of times I've had some relatively significant or minor injuries, honestly, and then just been blown away by how much out of pocket costs. Even when you have good health insurance, it feels like it still is on the edge of, breaking the bank sometimes if you just go in for a minor thing. I mean, there's been multiple times in my life where I've put off going in for coverage because I just didn't want to incur the cost until I was confident that I was very hurt or very sick. And so I get that completely.
Yeah, I think that seems pretty common in a lot of folks that work outside. This is a really interesting result here. This is the average monthly cost of healthcare that people were paying. And this includes healthcare premiums, this includes your out-of-pocket costs, anything like that. And you can see like there's a lot of people who aren't paying very much. All those people way over here on the left from 0 to 250, that's kind of our main category. And I think a big reason for that is that encompasses a lot of the people that aren't insured. So they're not paying healthcare premiums at all. They're not paying anything for healthcare until they do go to the doctor, right? And then there's a lot of young healthy guides like myself who are paying under $250 a month for their premiums. Other than that, they don't have very many out-of-pocket costs. On the other hand, though, you have this really long tail out to the right here, and you can see it goes all the way up to $2,500 a month. So you do have these people that you have a lot of people that aren't paying very much, but then you have a lot of people who kind of end up paying quite a bit per month over time. And that's another thing to keep an eye on is, that's kind of where health insurance comes in, is to try and buffer that cost, but doesn't seem like it's always doing the job.
I also wonder how much of the tax credit that people are getting keeps them in that sub 250 a month area.
Absolutely. I mean, it definitely does for me. So I would imagine that's probably part of it. Okay, this question kind of got at, how people are using their healthcare, right? So we asked, in the past year, have you utilized care? Or have you delayed that care? Have you foregone that care altogether? Are you skipping preventive visits? Because preventive visits are a big way to keep healthcare costs low in the long term. If you go to the doctor now, you catch a problem early, it's a lot cheaper for you, over the next 10 years or whatever it is. And we saw some really interesting things here. I mean, first of all, a lot of people are utilizing care. 62% are utilizing care, but then a lot of them are delaying that care. And then a significant number, I think, are foregoing that care altogether. So only a small amount of people that are basically not needing healthcare at all. They're not utilizing care, or they're not, wishing that they could utilize care. And I thought that was pretty interesting, that small number that have not done any of the above.
Yeah, that one's I don't really even understand how you either utilize it or you didn't. Who those 7% are. It seems
Yeah,
like you have to have been one of the others, or you just avoid it. If you didn't have any illness that you avoided going in for, you also didn't go in for need to go in for anything, I guess. But it's a
yeah.
strange number.
I think those people just didn't think about their healthcare probably at all.
But yeah.
This is another really relevant question. It's something that's been in the news a lot recently, is funding for rural hospitals, clinics, and health centers. I would imagine most of our members, I think 80% of our members, are in very small towns, and there's very few people in the state of Idaho that are using non-rural hospitals. So if you're outside of Twin Falls, if you're outside of Boise, Pocatello, and Coeur d'Alene, I think are the 4 areas you're using what is considered a rural hospital. And so 43% of our members are using those rural hospitals on a regular basis. And I think that's pretty significant, and especially to be doing that on a regular basis.
Yeah. And I wonder if we changed it from regular basis to have you used a rural hospital in the last 2 years, if that number would skyrocket. Because there's a lot of folks who operate, maybe they live in Boise or some of those, place like that. But then during their operational season, they're going to the health clinic in Riggins, or they're swinging in McCall, or they're going to Salmon or something like that.
Yeah, absolutely. That's certainly true. Guys move around a lot. And so their usage of a hospital might be irregular. I want to dive a little bit more into this kind of uninsurance category, because those are the people that maybe are at the biggest risk of experiencing catastrophic medical financial issues, or not getting the care that they need. And by and large, the number one reason for these people not being insured is cost. 71% say they can't afford it, and they didn't think that they qualified for any kind of subsidy, whether that's Medicaid, whether that's the advanced premium tax credit, which we'll get into a little bit, anything like that. And then there was a number of people who didn't know how to sign up, and they didn't know if they qualified. And I think those are 2 places that, education can be really, really beneficial in helping get people get the health insurance that they need and the healthcare that they need. And then this other category, there was quite a bit of varied responses to that. Some people had work and family obligations that kind of prevented them from signing up. Some people had their healthcare expire when they're out in the backcountry. Some people didn't sign up because they were working in places that it just wouldn't be helpful because their access to healthcare was so far that they probably weren't going to go anyways. So there's a lot of reasons out there, but by and large, I mean, cost is the number one.
Yeah, that makes sense.
So getting back to that barriers to healthcare question, if we look at the difference between people that are insured through the ACA marketplace and people that are not insured at all, we see some pretty key differences. So right here on the left, these people are insured through the ACA marketplace. On the right, they are not insured at all. And you can see both of these groups are really concerned about the cost of healthcare. 63% of ACA marketplace users say it's too expensive. 75% of uninsured users say it's too expensive. But then we get down into these other reasons. So obviously, I'm uninsured is a big problem for these people. People that have health insurance think that their coverage is confusing at a much higher rate. People that don't have health insurance, they have a lot less trust in the healthcare system. And I think that's key, is trying to, help people understand how the system works, how they can use it best to their benefit, showing them how they can avoid kind of the pitfalls of the healthcare system. Those are all things that I think would help this group quite a bit. This one again is looking at the difference between people insured through the marketplace and people that are not insured. And you can see the healthcare utilization rates are much, much higher for people that are in the marketplace. Their general practitioner rate, they're 85% are using that service regularly. That's like your family doctor, just the person you go see every once in a while for your regular checkup. Only 50% of the uninsured market is using the general practitioner. And none of them are seeing a specialist at all, at least in this survey. You see dental care is much higher in the marketplace versus non-insured. The one place that is higher is alternative medicine. So like homeopathic, stuff like that. And I think the reason for that is likely because it's generally more accessible and more affordable than more traditional institutional medicine. Emergency services are about the same. So, that makes sense. If you have an emergency, you don't really get to think about whether or not you want to be paying for that. You're going to kind of have to just go with it.
Yeah, but it's interesting in that uninsured side, one of the arguments you regularly hear, or conversation pieces you regularly hear around insurance, is the fewer people, like ERs can't turn you away. And a lot of times people who are uninsured can't pay the whole bill or even chunks of the bill, and it gets written off. And ultimately that increases cost for everything else in the hospital, is the write-off of that. And I've always kind of questioned the validity of that, but these results here do kind of indicate, we have a pretty high use within the uninsured market of that emergency services use. So it does kind of speak to that bigger story that you hear out there as being maybe somewhat valid. Kind of interesting.
Yeah, that's a good insight. How many of the emergency services users are being pushed there because they didn't get the preventive care that they needed earlier on.
Absolutely.
All right, this is another question about healthcare utilization. Getting back to that, in the past year, have you done any of the following? And you can see people that are insured they're utilizing care at a much higher rate, not much higher, but a few points higher. But they're delaying and foregoing care at much lower rates. So they're not waiting to go to the doctor. They're not putting off going to the doctor altogether. I think it's interesting that those people, though, they responded that they have foregone a preventive visit at a much higher rate. Look at the difference between the two. So people that are non-insured said that they only forewent a preventive visit 25% of the time versus 50% of the time. And it's can be hard to square that circle. I would imagine it's less a case of people not going to the doctor, and more a case of people that are insured having a greater knowledge of what their preventive visits are, and kind of understanding what that regular system of checkups are, because they have more access to the healthcare system in the first place. So they know when they're missing it. That's just my speculation, but I think that would be a better explanation than saying that people that are not insured are getting a lot more preventive visits.
Yeah, I would generally agree with that. It's probably a different assumption around what preventative visits are.
Yeah, absolutely. Okay. I threw this question in here because I think it's important to kind of understand who these two groups are. This is just a question about annual household income. And so you can see the people that are insured through the marketplace do have a little more household income than those that are not insured. But there's a lot of overlap. There's a lot of people in this 25,000 to 50,000 category, and a good amount of people in this 50,000 to 75,000 category. And the reason that that's important is those are the income groups that are out of the Medicaid category, so they're not getting free healthcare through the government, but they are being subsidized to purchase healthcare on the marketplace through the advanced premium tax credit. And if you're not familiar with that, you should go look it up right now because it's really important to your access to healthcare. If you're an outfitter and guide in Idaho, for a lot of us, it's the number one way to get that. And these are the people that are most well positioned to take advantage of that tax credit. And I wanted to point out the similarities here because I think a lot of these people in the not insured group have the opportunity to do that and move themselves from not insured to insured in that way.
Yeah.
Yeah, one of the questions we asked that I think we were most interested to know the results of, we wanted to know if people qualified for the advanced premium tax credit or if they even knew that they did. And I think this is key to the whole idea right here. So people that are insured through the marketplace, they qualify. 72% say that they qualify. Only 14% say they don't qualify, and 14% said that they don't know. If you go over to people that are uninsured, only 7% say that they qualify, 14% say that they don't, 79% say that they don't know. And I would bet you that a lot of that 79% are eligible for that tax credit and could take advantage of it to get affordable health insurance. That's what I do. That's what a lot of the people I know do. And it works really well. And it can be a really good way to bring those premiums down to a rate that is affordable for you in the long term. A couple key quotes here. Just wanted to pull these out. Some people, they want to have affordable premiums. They want to keep their premiums low. And usually to do that, you have to pick a high deductible plan. And that can make your out-of-pocket expenses go up quite a bit. I think that's a theme that a lot of us have heard about, have experienced. There's guys out there that are concerned about losing insurance when they turn 26 and finding healthcare coverage that's affordable and adequate. We had one quote, talking about the advanced premium tax credit and the healthcare exchanges. And this person felt that anyone who's not getting great healthcare in Idaho at this point is missing out because those tools can actually be so helpful for our demographics. And then one last one, this person said, I rarely go to the doctor unless something is bad. Which again, you hear that about people working outside where they don't go to the doctor until they absolutely have to.
Been that person.
That person.
Multiple
We've all been
multiple
that
times
person.
I've been to the doctor where been that person.
That person.
Multiple
We've all been
multiple
that
times I've
person.
been to the doctor where they're like, yeah, this has been broken for a long time. You should have fixed it a while ago.
Yeah.
Well,
Um,
didn't want to pay the money.
just to wrap this up here, we have a couple demographic questions. What is your gender? You can see we have a relatively even gender split. It's a little bit biased towards male respondents. Our household income question is a fairly even distribution across all the income levels. And then age groups are also pretty well distributed. So just looking at those, off the top of my head, I think we have a fairly representative sample. Obviously, it's not randomized, but I would say it's good enough that we can draw some conclusions for this.
Yeah, absolutely. If you look at the overall size of the outfitter and guide community, those age demographics to me feel pretty consistent with what you would see as far as where those would be spread out. We have a lot of young guides in this industry, and so you're seeing that return. That all seems like it matches with what my expectations would be.
So I'll stop sharing, but what do you think about this, Erik? What are your conclusions that you can draw from this top line for our members?
Big conclusions are that this healthcare conversation matters to our members. That the folks, a huge chunk of our membership, outfitters and guides here in Idaho, are utilizing the exchanges to get health coverage, that the tax credit is important to a big chunk of them. And I think one of the other pieces, and I'm not sure we showed this slide, but we asked the question of if your health cost went up 20% or more this year, would you be able to afford healthcare or health insurance? And I don't remember the exact number, but it was a significant number of the respondents across all age spectrums, everything else. They said that they said no. If my health insurance goes up 20% or more, I will not be able to afford health insurance. So I think that was a really interesting one. And I think the other piece that I'm not surprised by was the utilization of rural hospitals and just the conversations that we're hearing in the news around if there's a significant drop off in coverage, especially in rural communities, and they stop going into hospitals, they avoid preventative care, all of those kinds of things, that the economic model to sustain those rural hospitals becomes much tougher. And so that was something else that just when I'm thinking sort of big picture systemically, as someone who lives in a rural community, as somebody who has lots of friends who live in rural communities, and utilize the hospitals, the doctor's offices, all of those things in those places, that was something that really jumped out at me.
I think that's going to be really important to monitor moving forward and making sure those rural healthcare centers are able to provide the care our community needs. And to that, the statistic about out-of-pocket costs, it was 48% said that they would not be able to keep their healthcare if their out-of-pocket costs went up 20%. So basically half would lose or potentially downgrade their healthcare.
Yeah. Yeah. These
Yeah.
are hardworking, rural Idahoans
Mm-hmm.
who half of the folks who currently have health insurance almost are saying that they won't be able to afford it if their costs go up by 20%, which as someone who, we get healthcare off the exchange, like I'm sympathetic to that position for sure.
Do you think you could give an explanation of the premium tax credit for people that don't know what that is?
Probably not as well as you can, but I can give her a go. I mean, the general gist is you're getting a tax credit, so it's applied in your payment every month ahead of time. So not like you do it and then get a tax in your tax refund. It's actually applied as a payment every month. You go through kind of the process, you apply with the exchange, and it comes right out of, it goes straight to the company as part of your monthly premium payment. So it's not like money you get and then you pay to them, it just goes straight to them. But it does take off some percentage of your monthly premium payment that you have to pay to get your health coverage through the exchange. So the non-wonky answer. Jack could probably give you the wonky answer.
No, I think that was good. It's designed to, lower the money that you're paying every month for healthcare. And I think a lot of people, especially, in my age group, think that it's a tax credit that you have to apply for at the end of the year. And it's really not. I use it and I pay like a low month to the health insurance carrier every month. And then I never even have to deal with the tax credit. And if I make a lot of money at the end of the year, I might have to pay some of it back. But if I'm working as a guide, making my normal guide wage, I will never have to deal with that extra money.
Well, that's it. You plug in what you think you're going to make for that year, and yeah, when you do your tax returns at the end of the year, if you end up making a significant amount more than that or something like that, you could end up having to pay some of that back. To be perfectly frank, that's not a terrible problem to have. If you're making more money than you thought you were going to, you pay a little bit back into the system. But overall, I found it. This year was the first time we went through the exchange, at least since they were originally created, and I found it overall to be user friendly, relatively simple. It walked you through the process. It was pretty cool.
The one caveat I think to the tax credit discussion though is they are set to expire at the end of this year in their current form. So if you've been using the exchange in the past, or you are looking to use it in the future, just know that tax credit amount may change for you. It's not going to change for everybody. And it'll change the most for the people making the most money, but it will be different than it is. I know you can see online now, if you're going through yourhealthidaho.gov, you can see what your tax credit is going to be for the next year and what your estimated premiums are going to be for next year. So if you're looking to sign up for healthcare on the ACA exchanges and you don't have it right now, now's the time. That just opened. You can enroll for next year and get that tax credit and get yourself covered. So going into next guiding season, you're not left high and dry.
And Jack, correct me if open enrollment is from October 15th to December 15th, correct?
I believe so. Yep. So got to get it while it's good.
Yeah. And it's not an instant process. This isn't like I'm going to wait until December 14th at 10 p.m. and hop on and start going through the process. It does take a little bit. So get ahead of the curve and start looking now and start into that process.
Yeah. The last thing I'll say about that, and I don't want to volunteer him for this too much, but Hardy Bender is the resident healthcare expert at the IOGA, and he has worked on this for a long time. He's very knowledgeable about the healthcare exchanges, and he has contacts that work in the healthcare industry or the health insurance industry. So if you reach out to hardy@ioga.org or office@ioga.org, he has volunteered to help guides kind of get that set up for themselves. So you can book a 30-minute appointment with him, and he'll walk you through the process and kind of get you started on it so they can go start shopping for healthcare for next year.
Yeah, absolutely. Jack, thanks for putting all this together, giving us all that information. And this is a topic that'll be ongoing. I think we're going to have Jack, thanks for putting all this together, giving us all that information. And this is a topic that'll be ongoing. I think we're going to have some people that work in the insurance, help with the insurance marketplace and everything else. We're going to do an interview with them in the coming weeks. And so we'll have some more information on this topic. But thanks for tuning in. And if you haven't registered for our annual meeting in Wallace, Idaho, first week of December, we're going to have conversations around workers' comp. We're going to have conversations, I think, around probably insurance while we're there, as well as a bunch of other really interesting topics that benefit guides and outfitters both. So now it's time to get registered and come see us in person in early December.
All right. Yeah, hope to see you all there. It's going to be a good time in Wallace.
Yeah, for sure.
Awesome. Well, signing off.
Until next time.